My name is Nikki Herriott and I'm your CEO. I'm excited that you're joining us as we strive to fulfil our vision that people in the Northern Territory enjoy their best health and wellbeing. At NTPHN, we commission the delivery of health services and support the primary healthcare workforce so that Territorians receive the right care in the right place at the right time. Our team is building local partnerships and directing resources for an integrated and high-quality primary healthcare system. We have team members in both Darwin and Alice Springs working across 6 branches. While each team and branch has a distinct function, we work collaboratively and proactively to achieve the best outcomes for the NT's primary healthcare system.
So the Performance and Planning branch leads in the strategic planning, monitoring and evaluation of our work. We work with others to know our communities and their health needs, including how services work, the gaps and opportunities. This helps us to allocate resources in the best possible way. We build a picture using data, stories and research, and this information is then analysed to help inform service design. After services are commissioned, we continue to track the progress to see if this is making a positive difference. It's an ongoing quality review process.
We have a team of clinicians who offer clinical expertise and input on key projects across NTPHN. They also engage with national and NT health reform opportunities to develop tools and activities to strengthen and improve patient care. Our clinicians work across the organisation and externally to ensure the Northern Territory's health system works efficiently and collaboratively.
The core role of the Regional Partnerships and Procurement Branch is to work regionally to identify, co-design and commission health services. By doing this work at the regional level, we make sure health services are localised to meet needs specific to our distinct regions and populations. The Regional Partnership and Procurement Branch has 3 functions. Firstly, our Regional Partnership team engage stakeholders across the Northern Territory to develop strong partnerships and a comprehensive understanding of a region to enable local responses. Our Health Stream team work in partnership and collaboration to co-design and commission health services that meet local needs. Members of the Health Stream team are health and subject experts from fields like mental health, Indigenous health and comprehensive primary health care. They work closely with stakeholders in their field of expertise to ensure commissioned services are effective for both service providers and the community they service. The entire co-design and commissioning process is supported by our Contracts and Procurement team. This team leads our work in contract management, compliance and procurement for health services and programs commissioned by NTPHN.
The Workforce and Practice Support Branch works to recruit, retain and support practices and the NT primary health workforce, which is made up of GPs, allied health professionals, Aboriginal and Torres Strait Islander health practitioners and staff working in general practice. The Workforce and Practice Support Branch has 3 teams. Together we support NT health professionals and practices to find and secure a position in primary health care, develop their skills and qualifications, deliver primary healthcare including outreach services to communities across the Territory, and build their business skills to deliver sustainable primary healthcare. The recruitment specialists in our rural workforce team find and secure primary healthcare positions for health professionals in the Northern Territory. As part of this work, they also recruit GP locums to offer temporary relief to GPs working in regional and remote communities. They also manage programs that offer health students from across the country a primary healthcare career pathway in the NT. The Rural Workforce team work to ensure communities across the NT have the right health professionals with the right skills at the right time. The Outreach Health Services team coordinates outreach allied health services into remote communities. By coordinating these outreach services, people in rural and remote communities receive primary health care services that meet their needs locally at the right time. The practice support team has a broad knowledge of general practice and help improve business practices and sustainability. They work closely with practices to provide advice and support on accreditation, data management, digital health requirements and business support, plus more. The practice support team also organises continuing professional development, education and training for health professionals. Their focus is on ensuring primary healthcare professionals and practice staff have the right skills to help Territorians enjoy their best health and wellbeing.
The Operations Branch provides corporate support and services that enable NTPHN to achieve its objectives. We provide financial, human resources, ICT solution and risk and governance services across the organisation. Our teams have specialist staff whose expertise helps to inform and guide how NTPHN conducts its business. Our People and Culture team. They're our human resources and work health and safety hub and support the entire organisation. Our Finance and Risk Management team ensure NTPHN maintains good governance and financial practices. They manage the organisation's finances, identify and manage risk, and make sure we comply with governance requirements and best practice. Finally, our Systems and Change team identifies and maps opportunities to improve NTPHN's business practices.
I look forward to working with you to support Territorians to enjoy their best health and wellbeing.